Okay, so you just tore your ACL. There's a lot of different things going through your mind. You're thinking about limited duty, you're thinking about your next command, you're thinking, I'm sure, a lot of different things. So there's one thing that I think we should talk about that's going to be really important for the next process, okay? So when we talk about the inflammation response, inflammation, very, very fancy word for when your knee gets really swollen, okay? So I have a really great diagram that I'm going to show you from the infographic that I made, and you're gonna see your knee, because it just happened, is gonna go, it's gonna get super hot. It might get even a little red. You might have some swelling, which is a really, really fancy word for where it kind of opens up like a balloon, like your knee is gonna look a lot bigger than your other leg. And then you might be tender. If you were to touch it, it's gonna hurt, and then you're gonna have pain. Okay? And if you look at the infographic, we're gonna talk about that. So your capillaries are gonna widen, which is going to increase blood flow, which is going to have a heat response. So as those blood vessels open, more blood flow is going to go to that area, which is going to increase the heat and the temperature of your skin. So don't be worried if you touch your skin, it feels hotter on the injured side. And then if you look at the thing of a cell membrane and things like that, it's going to widen, which is going to increase swelling and more protein. So swelling is going to allow your joint to get bigger. So if that's why, if you were to look at one leg, the injured leg is going to be bigger than the opposite leg. And then of course, if you're going to look at it, it might start to be bruised. It might start to get red. It might start to get purple. That's all normal. The inflammatory response is a normal thing. And then the other thing is the pain. So you're going to have these leukocytes, which are white blood cells, and those are the I want to get the exact words you understand. They're like the firefighters. So the firefighters come in, they go, oh no, something happened, and they're going to fight. Okay, and that's going to cause pain. So, you know, within these next 3 to 5 days, usually a maximum of only 72 hours, you are going to have this response, but the best way that you can control it, okay, is going to be compression. So I want you to use this ACE wrap, and you're going to wrap it around, okay? But with the compression, right, you can take that compression sleeve off and you can work on some motion within your knee. We can do some heel slides. We can do some quad sets. And of course, I'll show you all those. But those are going to be really important for you to make sure that you maintain that motion, because although rest and ice and compression are all important, actually mobilizing the joint and actually getting that knee to move is going to be the most important. And I know that you've been sleeping with a pillow underneath your knee, which is causing your knee to be in a flexed position. So what I want you to do is take that out, and you're going to just sleep with your leg, which is going to be uncomfortable, but that's okay. You're going to take that out, and you're going to sleep with that knee in full extension, okay? And don't get me wrong, it might be uncomfortable at first, but that's okay. And then over the next couple days, you're going to work on compression. So you're going to use an ACE bandage to kind of wrap that area, and then maybe a little bit of ice. You can do ice here and there. You know, within the inflammatory response, it might be beneficial, it might be not. If your body likes it, then continue doing. If not, then you don't have to, and then you're going to follow up with me in the next couple days, and then we will go from there.